Hello and welcome to another special edition of OncoDaily's virtual interview series. I'm Harutyunyan, medical oncologist, palliative care specialist, and director of OncoDaily LA. As part of our dedicated coverage of the 22nd International Conference of the Society for Integrative Oncology, we are spotlighting leaders whose vision and work are shaping the next chapter of integrative cancer care. The Society for Integrative Oncology continues to advance evidence-based, patient-centered approaches that unites conventional oncology with integrative therapies. This year's meeting brought together experts from across the globe to share breakthroughs, innovations, and collaborative strategies. Today, I am honored to be joined by Dr. Santosh Rao. Dr. Rao is a medical oncologist specializing in genitourinary cancers and serves as medical director of Hematology and Medical Oncology at Cleveland Clinic, Akron General. He is also the immediate past president of the Society for Integrative Oncology, where he helped expand the society's global reach and advance initiatives that integrate lifestyle medicine, complementary therapies, and equity-focused approaches into mainstream cancer care. His work exemplifies how integrative oncology can be both scientifically rigorous and culturally responsive. Hi, Dr. Rao. Thank you for being with us.
Thank you for having me.
What made this year's SIO meeting feel unique or especially meaningful to you as immediate past president?
I think that it was a really well-developed conference. I love the fact that we were able to touch on many kind of a broad theme with expressive arts. There was some focus on lifestyle. We even had a talk on AI. It was a very broad, excellent conference. We also had great, attendance as well. And it all is, whenever you have a conference, it's really about the people who are there. So there was a lot of wonderful conversations, and that's really what the society is all about. And the conference, the annual conference in particular, is about bringing people together, looking at the scientific work that they've contributed. And it's not just the talks, but it's the meetings, it's the conversations with advocates, etc. That's how we really, make a difference in furthering the field.
Thank you. For those who may be new to the Society for Integrative Oncology, how would you describe its mission and role in shaping cancer care today?
The mission is really to focus on the evidence-based practice of integrative oncology and around disseminating knowledge and helping people, however you intersect with cancer, whether you're a patient, whether you're a caregiver, to use that evidence to promote improved quality of life and improved outcomes. That's really what the mission is.
Looking back on your tenure as SIO president, what accomplishments or milestones stand out most to you?
I think that we had a lot of challenges in our organization, and we were able to really pull together to bring our organization forward through those challenges, stabilize things, and then throughout that process we were able to further our mission. So I think some of the accomplishments, and it's never about me, it's as a president, my role is to make sure that we are communicating, that I'm advocating for people, and to keep people kind of coordinated, excited, those kind of things. So some of the main accomplishments we've had, other than two really successful conferences at City of Hope and Dana-Farber Cancer Institute, we have a textbook that's coming out by, I think, something like 70 of our authors through SIO on integrative oncology. Our patient advocate committee, alongside many other people, helped create this patient ebook, which I think is really fabulous. Many of us in practice do something around this kind of concept. How do I get my patients to understand what's out there? What are good resources? How do you start as a patient utilizing integrative oncology? I think that could have a lot of impact. We also worked with Dr. Jun Mao and Memorial Sloan Kettering to create a consortium through 35 National Cancer Institute centers on research to implement acupuncture and massage called the Imagine Grant. And then finally, there's a few more things. We had our first international conference in Oxford. So we're really expanding globally. And I'm also very excited about some of the partnerships with, the Multinational Association of Supportive Cancer Care, We have other organizations like British Society for Integrative Oncology, the Academic Consortium, as well as journals, Cancer Choices. So we've really partnered, and because of our positive reputation in this field, people are reaching out to us, and it's a way to really expand our voice and work alongside others instead of in silos.
To continue this topic, how do you see integrative oncology being adopted across major institutions, and what barriers still need to be addressed?
So I'm going to speak from my perspective because I think that our field is expanding. Integrative oncology, if you look along the landscape, especially in the United States, for example, at major cancer centers, there's usually some offerings for integrative oncology. And that is based on the fact that now many integrative therapies are in our NCCN guidelines and others to really help manage symptoms. Lifestyle, a focus on lifestyle is very evidence-based now, is very obviously standard of care. So there is some element of this. And at the same time, I think the barriers are how do we implement it? Does it have to look the same? And, in many of the big centers, there's a certain type of model that often is discussed where, integrative oncology has a certain role, but that model doesn't always fit with every single center. For some places, integrative oncology may sit within survivorship or palliative care, for example, and that's okay. And in others, it may be separated. So I think we have to be flexible with the concepts. And I think the other real barrier that we have is how we practice, where, at the end of the day, what are we trying to accomplish? We're trying to, first of all, help people throughout their cancer journey with anything that they may need help with. So that may be symptoms, that may be stress management. We're trying to focus on education, where unfortunately many people do not know the impact of lifestyle. And so, a lot of it is around education and meeting the patient where they are. And then what we want to do is to give them options and tools and treatments to help them. So those are kind of sometimes limited, that last step, where we may not have enough people who are educating the patient individually, whether it's a dietitian, whether it's an integrative oncologist. We may not have a specific stress management program in place. And these are things I see where, if you have an in-person meditation program, is there space? Is this something that most people come to? Do they want to come to the center? And it may be in some places that is the case. In other places, it's not always that easy. Do we have enough acupuncturists or massage therapists? And is there a mechanism for us to support that? And can patients afford it? So there's an affordability issue, but it all comes down to access and scaling of these services. And so, other programs have gone through a similar maturation process where you start talking about how important this is, but we don't yet have a way to make it easy for patients to afford, and we don't yet have a model to scale up where you can just create more acupuncturists, massage therapists, or integrative oncology providers. And so I think that solutions have to be, creative to not only work on affordability, but also availability.
Oh, thank you. What areas of integrative oncology research, whether lifestyle interventions, mind-body therapies, or novel approaches, excite you most right now?
I think lifestyle. I think there's a lot of opportunity with microbiome research. Some of that is early in terms of how it impacts not only cancer development, but also response to therapy. So to me, that's very ripe because, I think we're getting to that place in oncology and medicine where we're really actually asking the right questions about, what somebody does and what somebody eats and their lifestyle. How does that impact us biologically? And many, I think for a long time, we haven't really looked at it in the right way. And I think the more we learn, the more potential impact that will have. So I think that's really, really important. I think the lifestyle part of it is important, and at the same time is more kind of makes sense that eating right, exercise, sleep. I'm very interested in sleep research as well. I think that, as a people, we often don't focus on sleep. And, cell phones don't make that easier, and TV and everything else that we're exposed to. But cancer patients in particular have issues with sleep, whether it's through symptoms, stress, sometimes, medications like steroids, etc. And so that is also, I think, really important to keep figuring out what the biology of impact of that is, as well as the, kind of psychosocial impact.
Okay. You have emphasized also the importance of reaching underserved communities. What strategies do you believe are most effective in ensuring integrative care is equitable?
I think first and foremost, we have to have a strategy for insurance coverage. It's very difficult if somebody doesn't have insurance coverage, but right now there's a lot of out-of-pocket expense. And so what we're doing is we're talking about the evidence. We're showing that, hey, if you can, do stress management, and if you can get acupuncture, if you can, talk to somebody early, et cetera, in various places, that's not always affordable, or is it even accessible, depending on the area that you live in. So that creates a gap. And there are already gaps that exist, for people anyways who are going through any medical concerns. So I think insurance coverage is going to be a highlight and focus for all of us, because then you can make it more expandable. I think beyond that, we have to really talk to people and work with our community partners on what are the needs. And it looks different for different communities. And so, that goes beyond integrative oncology. How do you work alongside people from different communities? Part of that is having a diverse workforce. When we talk about research, we want, diversity in our research personnel. Same thing with our workforce, should be diverse and should be community focused. And then, adapting our strategies to different communities so that you have the best efficacy in that community. It's not going to look the same everywhere. So I think reaching out, and then I think we need to be creative, because there's different issues that are occurring in different communities. There may be space issues. In addition to funding, there may be transportation issues. And so, I think there are creative ways. I personally think that, using virtual programs may work, although that has challenges as well. So I think that this is something that we all need to kind of come together on.
As immediate past president, what legacy do you hope SIO will carry forward, and where do you see the society breaking new ground in the next few years?
I think our legacy is really around creating this structured approach that has gained respect, on really focusing on evidence-based practice. I think one of our main legacies is our guidelines, where we've developed guidelines for many things, including symptoms like pain, fatigues, anxiety, and depression. And, people use that, and we will continue to promote that and continue to develop guidelines as a way to garner respect for these therapies, to show that we have a high level of evidence, and eventually, hopefully, gain insurance coverage. So I think that's our main kind of legacy, is that, hey, because there's lots of different ways to practice, but how do you coordinate care and develop a high level of kind of respect and evidence so that it's coordinated and people will adopt these strategies? I think where we're heading is to continue to work with global partners and to work with other partners to further the support for our field. We're going to continue to work on the evidence, but now there's a certain amount of evidence that's significant. How do we further the implementation and getting it more supported, and working with other partners to kind of expand this? And I feel like that's what we're going to be working on the next few years.
On a more personal note, what continues to inspire you to champion integrative oncology and stay positive year after year?
I think, first of all, it's just belief in this approach. I think that has always been my inspiration, is that, prevention and focusing on holistic approaches. That's just been my inspiration for my medical career. And then as you practice and you gain experience and you see things, and in my case, practicing integrative oncology, I've seen the benefit. And so that inspires you as well. And I think that there's so much going on from a scientific standpoint that it excites me to think about how some of the approaches that we talk about, we're learning more and more about how impactful this is. And hopefully we'll get more precise with our interventions and our approaches. And it's all about helping people, and I think that there's a lot of general support for kind of our approach and our basic attitudes towards health and healing. And, I think that's what patients want. They want the best care, but they want that to include focusing on how they feel and focusing on prevention and focusing on what they can do for themselves. So we talk about being patient-centered and empowering patients. And I think that that is so important. And that's not unique to integrative oncology, of course, but it's that approach where you say, look, we're partners and you're part of this. And that's not just something you say, it's actually backed by a lot of research. So that's what inspires me.
And Dr. Rao, thank you for taking the time to share your vision and experiences. It's been a privilege to learn from your perspective.
Thank you.
To our viewers, stay tuned for more conversations from the Society for Integrative Oncology's 22nd International Conference right here on OncoDaily. Good luck and take care.
Thank you so much. Appreciate it.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.